This is manifest in the distressing population health and economic outcomes that are there for all of us to see in various countries. On average, across the world, and we saw some of the figures here, it is quite harrowing to hear that as this video just finished, 15 women will have died. And it is really concerning that so many women continue to die, and across the world a woman will spend 25% more time than men in poor health. This reduces productivity and earning potential, but it impacts negatively just on the basic human life, particularly of women, children, and adolescents. In sub-Saharan Africa, the likelihood of dying from childbirth is 50 times much higher than it is in a place like Europe. Each year there are 35 million unsafe terminations of pregnancy. That is an astounding number. This is resulting in life-changing injuries for millions and the deaths of these many women who are subjected to this. In 2022, it is said that 4.9 million under 5 deaths were recorded, most of these from preventable causes. Low and middle income countries are in the end the most affected by this. They continue to face, the people who live there continue to face challenges of the fragility of their health system and in equitable access to health and health-related products. In 2022, an estimated 13% of adolescent girls and young women across the world gave birth before the age of 18. And in my own country, it has also been reported that girls as young as 11 are giving birth to children, thus dropping out of school, but more importantly, you can just imagine to their health themselves being so negatively and dangerously affected. And yet, we see a downward trend in donor aid for reproductive health and maternal and newborn child health as well. Countries are struggling with domestic funding allocations to cover all these essential needs. The Global Leadership Network provides a platform for leaders like ourselves to work together to address these persistent issues. And by leaders like ourselves, I'm not talking about the heads of state and government. And many of us who are here are leaders in one shape, form, or other, leading various organizations, various institutions, and various areas of activity. So once again, I thank Her Excellency, the Prime Minister of Denmark, Mette Frederiksen, and His Excellency President Ruto, and His Excellency Abiy Ahmed of Ethiopia, and His Excellency President Joseph Boakai of Liberia for joining this call to action. I thank His Excellency Julius Maada as well, Bio, of Sierra Leone, His Excellency Majaliwa of the United Republic of Tanzania, and also His Excellency President Faye, who would have been here but is of Senegal, for also joining in leading this initiative. We also appreciate the support of the WHO, as well as UNICEF and UNFPA as we move the global network leaders forward. Together, women and children and adolescents comprise more than 65% of the global population. Addressing their challenges, their needs, can in the end fundamentally shift the global health landscape. and this network will advocate for sustained and enhanced financial investment, contributing to the growth of nations and enabling individuals to reach their health potential. According to a report by a leading health economist institution, by addressing the health gap between men and women, we could boost the global economy by at least $1 trillion annually by 2040. By addressing the health gap, 137 million women could access full-time employment by 2040, lifting millions of women out of abject poverty. We must engage entities and organizations like the G7, the G20, BRICS, and many other blocs to carve out a focused agenda that ensures the necessary investments will be moved and flow into women, children, and adolescent health. This is an absolutely necessary area of investment. The Lusaka Agenda, which enhances coordination and accountability in health financing architecture, can be used to track investments. President Wegai, we knew that you were coming, and I'd like to welcome you as you arrive. So don't worry too much, you're sitting next to me, so you're okay. Now, in September last year, governments and philanthropic organizations committed to increasing investments to end the shortfall of funding for life-saving family planning supplies. These commitments must be upheld. The life planning area is another important aspect that we need to look at very closely. We need to give greater attention to ending gender-based violence as well. We have also seen that the high rates of unintended pregnancies contribute to maternal mortality, especially among young girls. The UN and the African Union, through the Maputo Protocol, recognizes the right to bodily autonomy, especially for girls and for women. Yet we continue to grapple with this question of termination of pregnancy at the political level. And as we watch television, we see the debate raging in a number of countries, and particularly some big and leading countries where a lot of electioneering is taking place. And did I say that in the wrong place? I shouldn't say things like that in a place where these things are happening. And this is even the case, though the WHO has presented evidence that where abortion is legal and where safe services are accessible, both unsafe abortion and abortion-related mortality and morbidity is reduced. The Global Leaders Network advocates for life-saving interventions as well as sexual and reproductive health rights. Now, as South Africa, we know this from experience. The Choice of Termination of Pregnancy Act, which adopted soon after our own freedom, contributed in 1996, contributed to a decline of termination of pregnancy-related mortality by 90% between 1994 and 2021. This law that was passed through a democratic process amidst robust debates and significant pushback, but it is now being implemented, and it has resulted in a great deal of progress and success. But in the end, scores of women's lives have been saved. Prevention of unintended pregnancies, comprehensive sexual education, and preventing violence against women and girls are still priority interventions. But complementing these with sexual and reproductive health rights can save more lives. We understand that countries have the sovereign right to make determinations on issues of termination of pregnancy, and that should be respected, because in the main it could be an expression of the will of the people. The Global Leaders Network is called upon to protect the rights of vulnerable populations and present evidence that demonstrates a reduction in morbidity as well as in mortality. We therefore issue a call to action. We call on heads of states and government to seriously take women and children and adolescent health up in everything they do and join the Global Leaders Network. We also call on countries as well as on donors and commercial and developmental investors to carve out a specific funding agenda for women, children, and adolescent health. And we do, yes, also make a call on countries across the world to collaborate and to work together and cooperate to meet the financing targets for organizations that support women, children, and adolescents' health. These include the Global Financing Facility, UNICEF, and UNFPA. We call on stakeholders in the women, children, and adolescent health sector to target those countries with the highest maternal, neonatal, and adolescent mortality rates. And there are quite a number of these. And we also call on academics and civil society to continue to provide evidence and compelling arguments so that urgent political attention and action can be taken, including investment in the health that affects women, children, and adolescents. And we call for equity in manufacturing, in access to sexual and reproductive health products, and in quality health services for women, children, and adolescents. And that should lead to the health systems being strengthened. And that also should address the health outcomes in the end. Now, as the chair of the Global Leaders Network, I want to thank everyone who's been involved in this critical initiative. And by your mere presence here and the work that many of you continue to do in your various positions and organizations, you are helping to move the needle. But we need to do much more to save the lives of millions around the world. And we can, I believe, reduce poverty and inequality. We can, I do believe firmly, that we can improve productivity and develop economies and transform communities across the globe. By improving the health outcomes for women, for children and adolescents, we will be taking steps in that direction. So if we all act together, but not only act together, but we need to raise the level of awareness and consciousness, because quite often you find that many people are not so aware and well conscientized about the alarming statistics that we saw in the video, that women continue to die needlessly, and yet we can take action to prevent that and to lessen the deaths of women, but to also improve their health. Women, children, and adolescents must be prominent in our agendas to improve health across the world. And so if we can continue with that resolve, we will certainly achieve a number of objectives. Thank you very much for being here.
Thank you, President Ramaphosa, for your leadership and for the keynote address. And it was really touching to hear that when the freedom of your people was achieved, women's sexual and reproductive health and rights were also secured at that time. The two went together, and we thank you for your passionate commitment to these issues and for speaking from the heart. Thank you so much. Now, I would like to invite His Excellency Dr. Ruto, the President of the Republic of Kenya, to come forward and tell us about his vision on how we can accelerate action to end preventable maternal, newborn and child mortality. Dr. Ruto, you have the floor. Thank you.
Thank you very much. Excellencies, distinguished ladies and gentlemen, it is inspiring for me to know that we are all here to actualize our shared aspiration to address missed opportunities in improving the welfare of women, children, and adolescents with urgency and a spirit of partnership. The Sustainable Development Goals and the Global Strategy for Women's, Children's, and Adolescents' Health were launched in 2015. Yet with only 5 years remaining to meet these goals, only 16% of targets are on track, while an overwhelming 84% show limited or no progress. It is deeply concerning that maternal mortality, stillbirths, and neonatal deaths remain critical issues in sub-Saharan Africa and Southern Asia. In 2020, these regions experienced 300,000 maternal deaths, 1.9 million stillbirths, 4.9 million under 5 children's deaths, and 1 million adolescent deaths. Although Kenya has made considerable progress in reducing maternal and under 5 mortality, challenges such as inadequate funding and limited capacity to provide essential services persist. We recognize that only a multi-sectoral approach, including healthcare, education, and community support, can accelerate mortality reduction. Towards this end, it is therefore essential to increase investment, enhance collaboration, and focus on primary healthcare to scale up key interventions like skilled birth attendants, vaccinations, and improved nutrition. Recognizing that only urgent collective action can save millions of lives by 2030, we have pledged to enhance partnerships and establish a dedicated fund for maternal and child health. This fund will help advance progress towards SDGs by improving service delivery and expanding access to essential care. From an economic perspective, keeping people healthy is immensely beneficial. Studies show that every dollar invested in maternal and child health yields $9 in returns through improved health and productivity. Any annual investment of $1.5 billion could save 35 million lives by 2030 and generate $100 billion in productivity and healthcare savings. We have a singular opportunity to escalate our contributions to global health initiatives and significantly enhance their impact by supporting Africa Health Strategy and CAMA campaign, that's Campaign on Accelerated Reduction of Maternal, Newborn, and child mortality in Africa as an ideal starting point. It is important to emphasize, however, that investments must be complemented with robust transparency and accountability measures. This is why Kenya supports initiatives like the Africa Peer Review Mechanism and Reproductive Maternal Newborn Child and Adolescent Health Scorecard to track progress and to prevent unnecessary deaths. The return on investment in adolescent health is estimated at between $5 and $10 US spent, with school-based and community-targeted interventions being highly effective. In Kenya, therefore, we are deploying community health promoters to bring vital health information and services directly to communities as part of our commitment to a sustainable and equitable future by securing the health and well-being of all women, children, and adolescents. We have had a robust conversation in Kenya. We had 2 programs that were running. One, Linda Mama, that was an insurance program to make sure that every mother who is going to give birth, the government of Kenya pays for the prenatal and postnatal services. We have since, under our new universal health care program, expanded that to include the child up to 5 years, so that we can take care of that moment in time when children are most vulnerable, between ages 0 and 5. We have also expanded what initially we called Edu Afia, or Education Afia, where we had an insurance program for all our secondary school children. Under our new program, we have expanded that to include every child from primary school to age 18, so that every adolescent has a government-paid-for insurance program to take care of their health needs. This expansion of the programs that we are undertaking is in partnerships with friends. And I am very happy that in this audience, Professor Senait, who is here, has been working with us and has gone out of her way to pay for some of our women and children in that program. It is a complementary partnership between private and public in making sure that we secure the health of our people. We have every reason to be confident that together, as President Ramaphosa said, we can create the future we envision by prioritizing equity and inclusion in healthcare access, increasing funding, and strengthening our commitment to SDGs. If we can act in unity and without delay, nothing can stop us. And I'm very confident that we will work this together, and you have our solidarity, support, and partnership. I thank you.
Thank you so much, President Ruto, for that strong commitment you expressed, and also for the focus on the primary health care, the skilled birth attendant, the vaccination, the nutrition, the whole package that is so important in achieving these aims. I'm now going to welcome His Excellency President Boakai of the Republic of Liberia to come and speak to us about his vision for putting women, children and adolescent health and well-being as a top priority on the global agenda. Mr. President.
Your Excellencies, distinguished ladies and gentlemen, it is a privilege to address this critical discussion on the health and well-being of women, children, and adolescents. This dialogue is essential as we work together towards achieving the 2030 Sustainable Development Goals, particularly the SDG 3, which focuses on health and well-being for all. Liberia is fully committed to this endeavor. We have made progress in reducing maternal and child mortality and expanding access to health care, yet challenges remain. Maternal mortality rates are improving, but still unacceptably high, and child mortality persists as a concern, particularly in the rural areas. Additionally, our adolescents face unique health challenges that require targeted responses. Political leadership has been pivotal in our achievements. Through strategic policy initiatives and strong partnerships, we have integrated health priorities into our national development plan. Our focus remains on several key areas. Maternal and child health. We are expanding access to parental and to prenatal and postnatal care, ensuring essential medicines are available and training healthcare workers to provide high-quality care. Our commitment to reducing maternal and child mortality is steadfast. Adolescent and health and well-being. We are recognizing our adolescents as future of Liberia. We are enhancing sexual and reproductive health education and expanding mental health services to prevent adolescent pregnancies. Universal health coverage. Achieving universal health coverage is fundamental to providing all Liberians with necessary health care. Our Liberia Health Equity Fund is nearing approval, aiming to ensure every citizen can access health services without crippling out-of-pocket fees. Mental health. We are expanding mental health programs and facilities to reach undeserved communities, recognizing the crucial and critical importance of mental well-being of our women. Despite the challenges of limited resources and ongoing global health crisis, we see opportunities to grow through international cooperation. Increased investment in health systems and capacity building will be very vital. Political leadership is crucial for accountability and resource mobilization to meet health-related SDGs. It is our duty to advocate for equitable healthcare access and integrate health priorities into our national agenda. I remain very much committed and I reaffirm Liberia's commitment to achieving health-related SDGs by 2030, especially for women, children, and adolescents. I urge all nations to join us in the shared responsibility to secure the health of future generations. With strong leadership and collaboration, we can ensure every woman, child, and adolescent has the right to health and well-being. Together, we will realize the vision of 2030 agenda. I want to thank you for your attention and dedication to this important cause. Thank you.
Thank you, Mr. President, and also thank you for emphasising the issues for adolescents, an area which the Partnership for Maternal, Newborn and Child Health has put a lot of focus on in recent years. Thank you for your leadership. I would now like to welcome here the Prime Minister of the United Republic of Tanzania, also speaking on improving health and well-being of women, children and adolescents as an aspect of national development. Prime Minister, you have the floor.
Excellencies, heads of state and government who are here, distinguished participants, at the outset, on behalf of Her Excellency Dr. Samia Suluhu Hassan, President of the United Republic of Tanzania, allow me to thank Your Excellency Cyril Ramaphosa, President of the Republic of South Africa, for convening this important event and for your regional and global leadership in the maternal, newborn child, and adolescent health. Your Excellencies, last year, you rightly noted that if we secure the health of child and women, we will improve the health of all humanity. Yet, we are far from achieving the Sustainable Development Goal of reducing maternal deaths for 70%, 100,000 by 2030. Alarmingly, about 800 women die daily from preventable causes related to pregnancy and childbirth around the world. This situation compels us to act decisively and prioritize a better future for every child. Excellencies and dear delegates, this meeting is important to agree on actionable steps to accelerate progress in women, children, and adolescents' health. Effective leadership is essential to strengthen health sectors and expand access to primary care. Long-term sustainable funding is critical. Every dollar or cents invested in health yields substantial societal dividend. Additionally, sharing best practice and focusing on data analysis will enhance our collective efforts. Ladies and gentlemen, in Tanzania, women of reproductive are 47.3% of all women. The latest survey shows that our maternal mortality ratio has declined by 8% between 2026 and 2022. While we have seen improvements in child mortality, the neonatal mortality rate has stagnated. These achievements highlight the importance of leadership, financing, cooperation, and monitoring in meeting of our health goals. Excellencies, heads of states, ladies and gentlemen, with these few remarks on behalf of the government of the United Republic of Tanzania, under the able leadership of Her Excellency Dr. Samia Suluhu Hassan, Tanzania pledges its support to the global leaders, Network for Women, Children, and Adolescents' Health. Maternal and newborn health is a top priority for us, and we are eager to collaborate with the global leaders to reach the crucial target. Thank you for listening.
Thank you so much, Prime Minister, and please pass our thanks back to the President for the priority she is giving to these issues. I'm now going to call on two ministers. Firstly, Dr. Ibrahima Sy, Minister of Health and Social Action, on behalf of the President of the Republic of Senegal. Minister, you have the floor.
Merci beaucoup. Excellences, honorables, distingués invités.